But 5 loaves and 2 fish are all that we have. The crowds are too big. We don't have enough. What are we to do? The disciples urge Jesus to dismiss the crowd, lamenting their limitations. My name is Megan Kennedy Farrell. We are so grateful to the Mission Office of the Archdiocese of Chicago for the opportunity to be a part of this weekend's Mission Cooperative Appeal. Today's global healthcare realities can feel much like the scarcity the disciples encountered in this gospel reading. 5 billion people around the globe lack access to safe, affordable surgical care. And 81 million people face catastrophic debt seeking surgical care every year. But Jesus is not bound by limitation or scarcity. He does not dismiss the crowd and say, "I'm sorry, there just isn't enough." Instead, he says, "Bring them here to me." He breaks the bread, shares the meal, and ensures that all are fed. Pope Francis also urges us not to be bound by what we see on the surface. He recently called this an important time to be open to the Spirit, who can inspire us with a new imagination of what is possible. A new imagination of what is possible. For the past 21 years, we at Solidarity Bridge have worked to imagine what is possible for our world and to act from that vision. Solidarity Bridge is a lay initiative of the Archdiocese of Chicago, responding to the gospel call to heal the sick. We connect medical leaders here in the US to their peers in Bolivia and Paraguay to increase access to needed surgery and other essential health care. Through focused training, key equipment donations, and strategic partnerships, we are helping the most vulnerable patients access safe and timely surgical care. Many common illnesses and injuries cannot be solved with a pill. Surgical intervention is often the best course of treatment to alleviate disability and reduce the risk of death from common conditions. Yet in Bolivia and Paraguay, where we work, most people cannot access this care. The need is tremendous. It is easy to be tempted by limitations and visions of scarcity. But we know another way is possible. We see it every day. Solidarity Bridge works in partnership with medical communities in Bolivia and Paraguay. Together, we operate 4 year-round programs in general surgery, gynecologic surgery, heart surgery, and neurosurgery. Medical mission trips support these programs, bringing US doctors and nurses to Bolivia and Paraguay to work with local physicians, surgeons, nurses, and other medical personnel. Since 1999, we have performed nearly 7,000 surgeries and delivered care to more than 66,000 patients. We redistribute equipment and supply resources. We help equip talented surgeons in Bolivia and Paraguay who are deeply motivated to offer the best care to those who have the least access. Since our founding, we have donated over $42 million worth of equipment, and this month, a shipping container will arrive in Bolivia carrying 8 tons of requested medical supplies and equipment. Our in-depth mission trip preparation invites personal transformation and cross-cultural exchange. Our US medical teams work in a spirit of mutuality, and their lives are deeply changed by the relationships they form with their medical peers. We foster long-term partnerships. Our strength as an organization has come from individuals, parishes, and corporate partners who have dedicated themselves in a spirit of solidarity to the health and success of our South American counterparts. Together, we've formed a marvelous bridge of solidarity. Today, our work is more urgent than ever. The COVID-19 pandemic is straining the already fragile health systems in Bolivia and Paraguay. And as patients are forced to delay needed surgeries, their conditions worsen and their procedures become more complex. Catholic social justice tradition teaches that the goods of the earth are God's common provision for all. As one human family, we are meant to share equitably in these gifts. In today's gospel, Jesus shows the disciples how to ensure that all are fed, not just some. This is our mission as church. At Solidarity Bridge, we seek a world where the needs of those who are most vulnerable are the priority, where medical professionals have the resources they need to serve their communities. This vision isn't some far-off dream. It is possible. It is the call of our faith. Will you help us continue to make this vision a reality? Thank you for your support of Solidarity Bridge.